Okay. So I just want to kick it off with introductions. I'll let all of our lovely speakers introduce themselves, starting with Jeni.
Hi everyone, my name is Jeni Hirst and I'm Director of Service Development and Delivery at BHA for Equality. BHA aims to address health inequalities and I oversee our sexual health and HIV work, including our PASH partnership, our Hive work in Greater Manchester and our services at Leeds Skyline.
Thank you, Jeni. Juddy?
Hello, I'm Juddy Otti. I was the PrEP and Prejudice Coordinator. Currently work with Africa Advocacy Foundation around prevention of HIV and support.
Thank you. Will?
Hey, good afternoon. It's really nice to be here with you all. Thank you, Cham and your team for the invite. I'm Will Nutland. I'm the co-founder of Prepster. We're London-based, but we work across the whole of the UK and beyond to tell people about PrEP and also to do advocacy work to increase access to PrEP.
Thank you. Will? Taku?
Hi, good afternoon, everyone. My name is Taku. I'm the head of social marketing at Terrence Higgins Trust, and I lead the team in terms of delivery of the Starts With Me campaign and National HIV Testing Week. So yeah, we are currently running a campaign on raising awareness on PrEP, and yeah, thought it would be a good opportunity to have a chat about it.
Fantastic. Thank you all. And I'll just jump straight into it. So our first presenter is going to be Jeni, and she's just going to talk about the Prepared project, which was an innovation project, and talk about how they went about it and what some of the main lessons learned were. If you just give me a second, I'm going to share my screen and you should be able to see it in just a second. Go for it, Jeni.
Great, thanks, Jan. Okay, I'm going to talk about a project called Prepared that we undertook in Leeds. The project was funded by the PHE Innovation Fund, and the aim was to raise awareness of PrEP in African communities across Leeds. And we worked in partnership with Leeds Sexual Health Clinic, and the project was evaluated by the University of Leeds. Next slide, Jan, please. The rationale for the project arose through a community survey in 2018, a couple of African football tournaments that were held in Leeds. Now, the survey provided confirmation of low awareness of PrEP amongst Black, Asian and minority ethnic communities, and in particular amongst African people. Of the 75 respondents that took part in the survey, 95% of those were male, by the way. 81% of the respondents had never heard of PrEP. And in addition to that, a large number of the respondents identified that they'd had a risk in the previous 12 months. So 19% had had sex with a partner from a country considered high risk, 4% of men had had sex with another man, 3% had had sex with a HIV positive partner, 3% had paid for sex, and 5% had used or accessed PEP. And 41% of the respondents didn't actually know what PEP was, which was quite high. Equally, everyone who identified these risks also stated that they would be interested in taking PrEP if it was provided by the NHS, which it wasn't at that time. And this clearly indicated to us that PrEP may well be a useful tool as part of a combination prevention approach. And that was the premise for this project. Thanks, Cham. So Prepared aimed to invest in developing more engagement and positive attitudes to PrEP and broader sexual health, and challenge stereotypes and stigma. So we were keen to develop this as an asset-based community development model, which could identify the skills and capacity within communities and utilise their strengths and networks and knowledge and disseminate information around PrEP. We recruited and trained 13 community champions who were already well-respected community members that had good networks and social capital. By resourcing individuals who were already trusted members of within their communities, the champions had the power to change and address any barriers in terms of HIV-related stigma and increase awareness of PrEP. The champions were recruited from communities with perceived high risk of HIV infection that was identified and defined through the high prevalence of HIV and STIs in the local gum card data. And at that time, these included Zimbabwe, Sudan, Cameroon, Kenya, Nigeria, and DRC. Thanks, John. So both qualitative and quantitative methods were used in terms of the evaluation, but the interviews with the champions and the participants of the sessions proved the most useful in terms of our learning. The surveys were administered to everyone that took part in the sessions and also to all the champions. And it showed that only 15% of those participants had any knowledge of PrEP prior to their intervention, and all demonstrated increased awareness of PrEP following the session. I think what was really noticeable that came through the interviews of the evaluation was the reactions from community members about the news that PrEP was available, and it really indicated that there was low levels of awareness, but also a real sense of outrage that that PrEP existed but was not widely known about. And this was shared across all the groups that took place, with people stating things like, PrEP saves lives, why are we only hearing about this now? Sorry. Throughout the interviews with the champions and focus groups, as well as within the PrEP sessions themselves, it was clear that the champions were trusted and well known within their communities. And this was really important in enabling them to get people together to talk about PrEP. So not just having the opportunity, but how to encourage people to engage, how to approach men and women differently, and how to use you know, issues of their culture and language in a positive way to talk about sexual health. And I think this really demonstrated that, you know, a one-size-fits-all kind of intervention is not only unacceptable for many communities, it's also really inaccessible and inappropriate. One of the recurrent challenges of the model was that it really relied on people coming together in groups. And this was critiqued by the champions in their interviews because of the issues of stigma and shame. It was difficult to organise a group session as such. So the champions were really innovative and creative in how they delivered the work. And they found a number of ways of getting around those challenges. And that ranged from, you know, having coffee mornings, to impromptu talks in hair salons where people could just listen in, or, you know, coffee shops and workplaces. And this model really inspired and provided energy and determination for the champions to spread the messages around PrEP. And sometimes even with strangers, and where it happened organically. Because many of these interactions were informal, the scale at which the information was spread by the champions is not necessarily accurately captured in the evaluation. And that's one of the limitations that we have. Evaluation also reported that the project had generated important connections across the different African communities. Sorry. And the champions clearly valued being part of a group which drew on each other for advice and resources and ideas and learnt from each other. All the champions who attended the debriefing interviews and focus groups reported feeling empowered and motivated and being able to do something for their own community. The project evaluation highlighted lots of learning, especially around personal empowerment and relationship capital, All of the 7 champions who attended the debriefing interviews reported feeling empowered and motivated, and were able to answer and sort of like emphasize further discussions around safety, efficacy, and implications around fertility. And this is because we'd worked in partnership with Lead Sexual Health, and the champions had had specific training through the consultants there. Not unexpectedly, stigma, inherited stereotypes, gender relationships between men and women, and issues of trust and morality were repeatedly raised within the sessions. Next slide, please, Chan. Finally, just to end on, a critical strength of the prepared model is that each distinct community had its own champion. As a result, people were able to have open conversations about the implications of taking PrEP in a supportive environment, with a trusted and known member of their own community, and in their local language, drawing on culturally appropriate idioms. Prepared provided people the opportunity to talk openly and flexibly and find ways that suited them in their own communities. And I think that's the importance of any future developments in terms of PrEP or HIV prevention in terms of reaching communities. Thank you.
Great, thank you so much, Jeni. That was really interesting. Just a quick snapshot. What struck me was when you were saying earlier that one thing that was consistent amongst all the communities that you spoke to was, you know, how they all really wanted to know about it and were surprised that they hadn't had an opportunity to learn. And I think it's one of the things we've also found in our work as well. Yeah, and I'm sure others are going to touch on it in just a few minutes. Sure.
I think it saddened me to some extent in the fact that, you know, it just felt so unfair. Yeah. Well, I suppose it's progress. Yeah, a gradual approach. So hopefully when we have that wider discussion, we'll talk about, you know, what are we doing and what do we need to continue doing and build on to change that. Now, I would really like to invite Juddy, who's our next speaker. And if you give me a second, I will put the slides up as well.
Thank you so much, and thank you so much, THC, for giving PrEP and Prejudice this opportunity to share our findings from our project. Just like Jeni, this was also another Innovation Fund PHE project, and lasted for 1 year. You can move to the next slide, my dear. I just wanted you to enjoy that bright color to bring some sunlight and sunshine and happiness before we go down into second lockdown. So a bit of a background, this was, like I said, a project funded part of the Innovation Fund, and it was mainly aimed to influence how Black African communities engage in PrEP, in HIV prevention tools, specifically the use of PrEP as an HIV prevention tool. It was a combination of 6 grassroots organizations, which gave it a lot of richness, because each of these organizations had worked with specific groups of people from Africa. So there was that specialistic that they brought to the partnership. And also we worked in Leicester, Leeds, Manchester, Hertfordshire, Bristol, and London. And our main aim was to develop, so we developed PrEP awareness campaigns that we pioneered in different settings. And it was mainly to encourage awareness and knowledge of PrEP among this community, as well as destigmatize and encourage uptake of PrEP in this community. We were able to do this through grassroots, you know, networking with community leaders, through Facebook groups, through radio channels, working together with professionals like Dr. Vanessa and Dr. Felicia to speak directly to people who are calling in and asking questions. Next slide, please. So what we wanted was to, in terms of outcome, was to have a clear understanding of the perceptions and attitudes of PrEP by this community, really to evidence the low uptake and that was being evident in the impact trial and in other uptakes of PrEP, to open discourse of PrEP among this community in a culturally acceptable, utilizing innovative and cost-effective approaches, and co-producing to produce successful digital information that could be embraced by this community, that resonated with them, that spoke to them and engaged them, really. And the next slide is able to at least show you some of what we were able to develop, which was vibrant, colorful, reflective of the community that we are trying to reach. Chairman, you can go into the next slide. And I just wanted to show that just so that you see. And it was key messages that we used around with PrEP, there's no worries. With PrEP, there's no wahala. With PrEP, hakuna matata. And also, how prepared are you to have a healthy sex life? And this was prompting questions like, are you HIV negative? Are you having unprotected sex? Have you thought of taking PrEP? And these were probing conversations within communities to know more about PrEP and also to see if it was suitable for them. We also produced a small video clip, and with key messages, if you can just go to the next slide. And that was, we realized it was essential to say what PrEP is, to say what the benefits of PrEP are, so that everyone, from people who may know a bit about PrEP, but to those who need reassurance about it being something that will be reliable, effective, empowering, and give you a peace of mind. So those are some of the key messages we picked from focus groups that we held, and felt that this would be a very empowering way, a very powerful way of conveying confidence of PrEP in the BME community. So if we go on to the next slide, we then talk about the key findings from this project, and what really surprised us, which also reflects some of what Jeni mentioned, was the lack of knowledge. This was the first bit is with staff and volunteers who are already working in this sector, because we took on the task of training staff and volunteers so that they are also upskilled on PrEP and can also have these conversations effectively. But 32% of them did not know what PrEP stood for. 53% of them did not know anyone who had accessed PrEP. And for me, that was worrying, because either people are actually not accessing PrEP, or those who are accessing PrEP, it's so discreet and it's a secret that it's not something we know. So there was a lot of things to read into and try and evaluate why these figures were very alarming. Then when we held the focus groups, there was 2/3 who had never heard of PrEP. Again, this is echoing what Jeni said. A lot of them were saying, why have we not heard about this? Why? Some were very open. I have struggled in so many, if I had known this was available, I can't use a condom, I can't do what, if I'd known this was available, it would have made life a lot easier for me. I think sometimes we fall onto the back that these communities don't really talk about sex. They do. I think we're just not communicating it in the right way. We are not finding those opportunities to discuss it openly in the right way. A lot of them were very skeptical about PrEP. It did not help that it was called the PrEP Impact Trial at the time. So identifying it as a trial brought issues around, are they using us as guinea pigs and all those kind of things. So we had to really build a lot of trust around it, and a lot of education around trials had already been done. It was because of it being a drug and the cost, and that's why it was being called a trial. We really had to go down into details of why it was a trial. And then there was also what was highlighted was the lack of appropriate PrEP messaging that was targeting this group. So the PrEP messaging is there, but it doesn't resonate with this group. So we felt that it was important we created messaging that actually resonates with the community. And then there was a stigmatizing connotation to PrEP around being promiscuous and being associated to the way it looks and looking like medication for ARVs. So some people felt if I'm seen with this, people will think I'm positive. So there was all that kind of thing. And then the need for targeted campaigns using influencers that already built trust in this community, using celebrities in these communities who people listen to, using community leaders, and already established networks, grassroots networks that are existing, and tapping into these to pass on this message we felt was quite important. If we can go on to the next slide. So in conclusion, what PrEP and Prejudice found is there was a great need, there still is, even up till today currently, there's still a great need to demystify PrEP misconceptions in this community. And hopefully this can be done by more PrEP awareness campaigns that are targeted to these communities. The need to address the basic lack of even basic HIV knowledge is something we found. Before we even start talking about PrEP, there's a lot of misconceptions about what HIV does, how it is spread. And then we really have to embrace education about PrEP as a whole package. We can't just take it as just PrEP. It's got to come with the HIV knowledge and condom and holistic, the whole package is what we found. The need to normalize PrEP, just like condoms have now been normalized, is something that we have a lot of work we need to do in this community. The need to address access issues, and some of the things that came up was around, because again, there's a lot of confidentiality issues in this community, around would there be opportunities for self-dispensing machines, for example, where someone could discreetly go and get whatever they needed without having to register their data and everything in a sexual health clinic and be prompted with so many questions. Maybe using pharmacies, for example. So it was around the access being only through GUM clinics or through other sources where they had to fill in forms online or buy it online. They was exploring other ideas. For example, a travel agency or an embassy before someone gets their visa. So there were all those that were discussed ideas that could be looked into. And also hairdressers and barbershops and trying to make it as normal like you would pick up a condom off a shelf, really. And then I know this would have to come with specialistic support around the pre-testing, but I think if we normalize PrEP, then we can, the message around getting all the other medical checks that are needed prior to taking PrEP will be embraced better. And then establishing a network of PrEP user champions. And this is something we found that was very valuable. We're able to recruit 4 PrEP user champions who were able to talk about their experiences. One thing we have to understand, PrEP in the BME community is consumed, for lack of a better word, in a different way. The reasons why someone will use PrEP in a BME community are totally different from other communities, and having people speak about those experiences as to how they're using it and why they felt the need to use it spoke volumes to those who did not understand what PrEP was or did not think they needed PrEP. You know, a woman who is in a relationship where it's a polygamous relationship that is culturally acceptable, how do they feel empowered to keep themselves safe discreetly? PrEP was a very good example, and this is something that we highlighted to women. You would have the power to use this. Then the need to build investment in capacity, building capacity in frontline BME-led organizations. These organizations have expertise. They already have produced the groundwork. They've done the groundwork. They've already built these relationships, which take a long time to build confidence, and they already have the channels. So investing in these groups, we feel, is something that needs to be looked into, needs to be addressed, needs to be valued, because we have to appreciate, like Jeni said, not one size fits all. but the expertise is already there. We don't have to reinvent the wheel. I think it's working together and empowering these organizations, which brings me to the last point, which is echoing the lack of investment in PrEP awareness, especially in Black African communities. A lot of investment is short-term, 1 year, so there's no momentum kept. We've created very beautiful resources, and it would be good with the PrEP champions that have been trained to continue this momentum and this message, so that the confidence is built and the product is known better in the community, and give it that time to organically get known. Thank you very much.
Great, thank you so much, Judy. I had a couple of reflections, but I actually just thought I'd open it up to any of the other speakers. Is there anything in either Jeni or Judy's presentations that really struck you? Putting you on the spot.
I guess probably some of the things we're going to talk about it more, so like in our presentations, but like all in all, I think what I would just say for now is there's nothing surprising so far, like in terms of, because that is one of the key things, which is there for anyone who's been following what's been going on with PrEP over time, like with Black African communities, these similar stories which are coming from Jeni, the similar stories that are coming from Judy, are things that we have to be really contending with as we go forward.
Will, did you want to say anything?
Maybe I'll say it when I start my presentation. How's that?
Sure, fine. So I was thinking, for me, it's a bit similar to what Taku, you're saying around there being a real consistency in the messages that keep coming up, in the approaches that seem to have the most impact, and some of the challenges across the board. But in a way, it's encouraging because, like you say, Judy, it sort of means we don't have to reinvent the wheels. And, you know, in a climate when, you know, there's so much we need to contend with, this is one element of a prevention tool. You know, we have to think about testing, condoms, you know, broader sexual and reproductive health information and awareness, and, you know, and other things going on in the world, people's priorities. You know, sexual health is, and HIV is one part of it, but how do we balance everything in the most efficient way and effective way possible? So that's really great that you raised those points. I had a question for you, Judy, around, you did mention that the digital campaign was supplemented by outreach. And in terms of addressing some of those thornier issues, like how did you think that was a model which helped you address some of those trickier things with the example that you gave in terms of how the usage may differ in, say, Black African and Black Caribbean communities compared to other communities? Did you think that the outreach helped you deliver some of that nuance in a way that the digital content couldn't?
Most definitely. I think PrEP messaging has to be tailored to particular users. And what I find in our community, a lot of men have long distance relationships, and women, and these may be within this country, they may be back home. How do you empower someone in that situation to keep, to stay safe? We know we go on holiday every year. Well, not now, but you go back, and our holiday is going back to your home country. You meet past relationships, or that's where your current partner lives. So how do you empower that person in that situation? And that's how PrEP can come in. But if you put the message out that use PrEP, it prevents you from contracting HIV, that may not go down to deep to the heart. I think what I should have said, I wanted to end my presentation with, and I forgot, was Nelson Mandela's, and I like this statement. He said, when you want to speak to someone effectively, if you speak to them in a language they understand, it will go to their head. But if you speak to them in their language, it goes to their heart. So if we are tailoring this message in their language, in a scenario that they live in, they most definitely will get it. We're not saying PrEP is for everyone, but I think we have to understand that how PrEP will be used in this community is very different, and it varies from community to community. A lot of men have, and I'm sorry I'm picking on men, but a lot of men have various relationships, sexual relationships. And in many African cultures, that's acceptable. And to them, they will be their partners, their wives. They might, that's how they consider them. So if you're telling someone, are you sleeping around, or are you having casual partners? Those are not casual partners to them. But how do they empower themselves, or how do those women empower themselves in those situations? Because that's where the risk is. Does that make sense?
No, yeah, that's absolutely brilliant. Thank you so much, Juddy. Yeah, okay, so just to keep us on track with time, I think we'll move ahead, and any further discussion points we'll cover in the second part of this webinar. Will?
Thank you.
I'll just share my screen.
Okay, so Cham, the reason why I didn't respond and jump in there was that my overall observation is what I'm about to say totally resonates with everything that Jeni and Juddy have just told us. And so there are a few points that I will reiterate and a few points that I will skip over because they've already been made twice. But I think this is a really positive thing that we have 3 Public Health England Innovation Fund projects that are really, really overlapping on our conclusions. And that means that collaboratively, we have an agenda for change that we kind of pretty much will all agree on. And I think that's a great stepping stone for where we go forward in the collaborative work that we do together about making sure that PrEP gets into the minds and, if appropriate, into the bodies of those people who currently haven't had access to it. So it's encouraging for me that there is so much resonation. Can I have my next slide, please, Cham? So I'm going to talk very briefly about a project called MobPresh, which is mobilizing for PrEP and sexual health. MobPresh was funded by the Innovation Fund last year, so it finished a little under a year ago, and it was a collaboration between PrEPster, Yorkshire Mesmac, and the Brigstow project in Bristol. So our 3 sites, Bristol, London, and Yorkshire. And there were 2 kind of pieces of evidence that we used to inform the development of MobPresh. The first was some research that we did about 2.5 years ago with gay men who were using PrEP, when we did 3 focus groups and asked them, if you looked back about where you got your PrEP knowledge and information and support from, where would you most like to get it from? And the response was an overwhelming, I want to get it from people like me. I want my peers to be able to help me understand how to use PrEP, where to access it, dealing with side effects. And that wasn't that those men were saying, I don't want the support of medical professionals, but what they were saying is primarily, I want to be able to speak to somebody like me, one of my peers, about PrEP and how to use it. So that was the first piece of information that helped to shape MobPresh and why it's a peer mobilization, uses a peer mobilization approach. The second piece of evidence that informed us came from an Innovation Fund project funded the year before that was done with the GMI partnership in London. And that was called the PrEP Champs project, and PrEPster helped to train and support about 80 frontline outreach workers and volunteers to do just shy of about 1,200 PrEP-related face-to-face outreach interventions. And at the end of that intervention, each person was asked to complete a very, very short questionnaire that helped to measure some of the kind of the key knowledge and attitudes towards PrEP. And unsurprisingly, what did we find? If you were a man, your main barrier to getting PrEP was access. I couldn't get on a trial, I can't afford it, I don't know where to buy it from. Overwhelmingly with women, hey, no surprise here, the main barrier was knowledge. I don't know about it. No one's ever told me about it. The narratives that Jeni and Juddy have just used about people kind of saying, well, this can't be true because if this was true, I would know about it, really resonated on all of the projects, the PrEP Champs project and this project. So MobPresh aimed to recruit self-identifying women. You can see on the visuals that we used that we were very kind of diverse in who we were trying to recruit into the project. And the idea is that we recruited, trained, and then supported these mob PrEP volunteers to do work around PrEP within their own communities. So we did 6 rounds of volunteer recruitment, 4 in London, 1 each in Bristol and in Yorkshire. And each project had a small kitty of money that they could use to develop projects that each of those mobiliser groups came up with. We quite controversially wanted to move away from a concept that our PrEP work, our PrEP education work would be provided by people who might have some level of association with us as peers, but maybe didn't have as many associations that lots of people said that they wanted. So for example, lots of the young Black African women we spoke to at the very beginning of the project said, I don't want my aunt or my mum or my nan to tell me about PrEP. I want my sister or my cousin or my friend. So we were trying to kind of recalibrate what we mean by peers, and that caused a bunch of problems that we probably won't go into today, but people don't like being turned away from a project that they want to volunteer from because they're not perceived to be a peer of the target group. But some really brilliant learning for people who want to know more about that. The project was independently evaluated through a process evaluation by Pippa Grenfell from the London School of Hygiene and Tropical Medicine, and I'll put a link up to that process evaluation report in just a second. So can I have my 3rd slide, please? So this just gives you an indication of some of the types of projects that happened at Mob PrEP. This is one of Yorkshire Mesmac's project, which is the first ever British Sign Language video about PrEP for women. But we did a whole set of different projects, including, as Jeni has kind of already pointed out, work in hairdressers, work in community events, work through churches and mosques, people setting up dinner clubs when they would bring bunches of peers and friends together under the guise that you're coming over and I'm going to cook you an amazing dinner, but actually we're going to by the end of the evening we're going to talk about PrEP. We did things like banner making with a trans and non-binary group in London just before Trans Pride, and we bought them pizzas and soft drinks and equipment to make banners. And we knew that if we'd asked those people, hey, come along to a PrEP awareness workshop, we wouldn't have probably got a single bum on a seat. Asked them to come along for pizza and soda and banner making, and we had 20 or however many people there who by the end of that knew how to access PrEP and where to get it from. So I think, Jeni, there's some real resonance here from what you've just told us about. So next slide, please, Cham. So I've stretched this image in a not very flattering way, but if you go to prepster.info/mobprep, you'll be able to read the full report, the full findings. And I just want to highlight, I guess, three kind of positive learnings, or 3 things about how we might move forward on a project like this, and then 3 things that kind of things to be aware of, things to be alert around. And Judy has already touched on a couple of these, so I'm going to keep these quick. The first thing that fell out of the Mob PrEP project, and I know that there are PhE colleagues here who will agree with this. This is not a criticism of you directly, but the short-term resourcing, the short-term funding of this work means that they are not sustainable. You'll have noticed that I am not a person of colour and I'm not a woman. The reason why we don't have someone from Mob PrEP talking about the project today is that we no longer have sustainable funding to keep that person in post. And most of the Mob PrEP volunteers, because we no longer have a person in post to look after them and to train them and to build up their support, most of those volunteers have gone on to do other things. I should say some of those volunteers thankfully have gone on to volunteer in other organisations that do have more staff and more resources. But ongoing resources of these projects, more than a year, we need to make them sustainable, and our process evaluation talks about this. Secondly, the process evaluation really hones down on the value of the peer support approach, having somebody like me helping me understand about this new technology. We've already heard about this, but the 3rd key finding was Don't come and talk to me about PrEP. Don't let your opening line be about PrEP. Position PrEP in the wider health needs that I have. And that might be the wider sexual health needs I have, but generally it's probably going to be the wider needs that I might have around being in prison or being in probation, or accessing termination of pregnancy services or contraceptive services or housing services or domestic violence services, all of these kinds of other services. But don't approach me with your opening line being about PrEP, because the first thing you're then probably going to have to do is go right back to square one and talk to me about really basic information about HIV. So again, some links in with what we've already heard. Linked into that really raises some fundamental questions about where PrEP is currently available from, and the fact that we've moved out of the impact trial and routine commissioning of PrEP is almost exclusively through sexual health services. Hey, and guess what? We're not going to see whole groups of people access PrEP if it's only available through sexual health. I've got three other alert things, learning things from the process of evaluation in this project that I think it's worth us just highlighting. One was that the peer mobilizers talked about blaming discourses and discrimination and stigma around HIV, sex and PrEP. And they reported back that the historical blaming discourses, the linking of HIV and PrEP with homosexuality or sex that may be taboo in some of our communities, was a real barrier to them. So a quote that said, PrEP makes people more promiscuous, was one of the things that people kept hearing about. So how do we try and break down some of that existing stigma around PrEP to facilitate new conversations with communities of people who right now aren't getting to know about PrEP? The second one, and Judy's already said, we've got it in for men today. So I've also got it in for men, because the women on this project said that they were fearful about engaging about PrEP in spaces where men were present. Some of that was in faith communities, but it wasn't exclusively within faith communities. And a quote that said, women hearing, what right do you have as a woman to have your voice heard within this space? So really unpicking some really deep-rooted homophobia in the point that I just made, and really deep-rooted misogyny in some communities that silence the voices of women. Every time I say that, I get really angry and sad and just so annoyed that we are still dealing with entrenched homophobia and entrenched misogyny, and that those things remain barriers to particularly women's access to PrEP. And then thirdly, and again, I know that Jeni touched on this, was that there was a sense from some of the mobilizers that the targeting of PrEP to certain groups of women, certain demographics of women, would reinforce blame and stigma about who has had HIV in the past. So a quote from a woman who was a mobilizer saying, I'm sick of hearing that it's Black and minority ethnics, people of color, who are very high risk. And we have a finding in here about how we might turn it on its head, how if we were doing this project in the future, we would better skill those mobilizers to be able to answer complex questions about epidemiology, rather than denying that there are some groups of people who are more likely to be involved in HIV acquisition. So can I have my penultimate slide, please? Because there is a despite what I said around funding running out, there is a living legacy of MobPresh. In the very, very final round of MobPresh volunteers coming together, they critiqued and looked at current materials that were available. Judy, I should said that PrEP and Prejudice wasn't full running then, so otherwise I think they would have had a really great example of the materials that you have put together. But there was a sense that some of the materials weren't talking to those women, and some of the materials weren't dealing with some of the issues that those women wanted to know about. So we've just, along with Greg at I Want PrEP Now, THT also kindly paid for the print run from this, have brought out this new booklet called Sisters Are Doing It For Themselves. If you can see my screen, it actually folds out into a little map, and then you have a beautiful A3 poster that you can put on your wall if you so wish. If you want one of those, please give me a shout. We'd be happy to get them to you. But that's a living legacy that's just come out of the MobPrEP project. The content, the concepts were developed by those MobPrEP volunteers. So very final slide, please, Cham. And so here are my contact details if you're not already in touch. Thank you so much for inviting PrEPs to be part of today's discussion. Bless you.
Not at all. Well, thanks so much. That was really, really interesting. And again, everything's sort of very much coming together. There were a lot of questions that I really had that came up in your discussion, but I think I will hold them until after Taku speaks, and then we will open it up to the floor. I can see there are quite a few questions coming in. Just a reminder, we're going to answer them all after everyone's had a chance to talk about their project and their campaigns. So just a little while longer. Great, Taku, I'll just do the slides.
Yeah, if we go straight to slide number 2. Okay, thank you so much, Cham. Like I said earlier, I don't want to repeat what's been said, because I think the things that have been talked about are sort of well documented across many projects, and they've been observed by many organizations as well. So as part of a response to what is definitely an issue which is ongoing, we were looking as well at what has been reported via the Innovation Fund projects, and thought, how can the national program also be sort of doing something around PrEP, like for Black African communities? So the focus was to say, how do we actually get people in the door? So with this campaign, which is PrEP Protects, the attempt was not to try, it's an ongoing campaign at the moment. The attempt was not to try to get people we're not saying people go and use PrEP. The initial point is us having sort of to kickstart a discussion about what PrEP is, so that people have an understanding. And within that, we then sort of gradually move towards having the conversations about actually sort of responding to people's needs around getting PrEP. So, so the whole idea is, with this campaign, we wanted people to be able, at the end, to be able to know what PrEP is at the very basic level, because as already have been alluded to by the previous speakers, the level of awareness of what PrEP is are fairly low, are significantly low. When you compare to MSM, where we've had sort of years, I think, of actually activism, of information sharing sort of happening at peer level, we've not had a similar thing happening with Black African communities. So this is why we started with this campaign. Next slide, please. So to address the issue of knowledge, what we thought about was like, how can we make sure that people can get sort of the basic information about PrEP? So with that, what we did was to develop a number of resources towards that. You won't mind the speaker thing at the bottom, at the other end there. It's just to signify that we did radio adverts. So we've got some radio adverts. We've got, we did some information, which is responding to some of the basic questions that people are always asking. So the article is where we drive people online to go and read a bit more information about PrEP, and it is more or less structured like an FAQs but what is also interesting about it was we had to really go down to basics with this, because we had the initial information, we sent it to people, we had discussions, and people just kept on saying, I just wanted to know some of the basics, because what you're asking of me is too high and you're explaining too many things which are complex. So for example, around dosing, people were like, I know there are many different types of dosing, but at the moment, I still just don't believe that there's this thing that works. Can you just explain in the most basic way first? before you give me sort of complex ideas. So what we've got is that page which explains like an FAQs. We've got a PrEP tool. So it's an interactive tool that people can click on and it will provide them sort of with some ideas whether PrEP might be useful for them or not. We also produce sort of an animation, which is the blue bit, which is much more around, the blue bit is much more around just explaining the basics of PrEP. So we created a lot of these to be shared on social media. Next slide, please. So the idea was like, okay, even if we produce this basic information, how best do we get it to the people who need to get it? The point, I think, which has been said already, Jeni outlined it a lot. When we talk communities, it's useful in our world, in our sector world, to talk of Black African communities, because it just puts everything sort of in one group. But the reality is, it isn't true for everyone else. The Zimbabweans are experiencing being Zimbabweans. The Kenyans are experiencing being Kenyans. Everyone is doing their own thing. So it's useful for us to think about Black Africans just for us. But from an experience point of view, forget about it. That's not how it works. People work in different groups. So we focused on actually working with influencers from different communities, which also involved, like, thank you to Nyambe and to Juddy, where we've involved some people who've worked on previous projects in this campaign. We're working with close to about 20 influencers for different countries, different African countries at the moment. We chose them on the basis of reach, whether they're actually going to be able to reach many people. We also chose them on engagement, whether people actually engage with them or not. Because sometimes we get influencers who come and say, I've got big numbers of people behind me, but they don't get engagement. But we would prioritize the people who get engagement. We also have some print adverts which are running to try as well to reach different African communities because they consume different print media. So we've done that as well. We're using display ads, so these are online display ads, which are targeting very specific community websites. Some of them are going via Google. So I usually say to people, it's like your Amazon ad. That's the best way to explain it. It will follow you around, but we are not following people around. We're just placing it in the places that they would be. So we're not following them around, but we're putting them in the places that they will be. We're working also with a number of African TV stations here. We're also doing, running the adverts, but they're also organizing some chat shows. As part of the chat shows, it gives us the opportunity to have a more detailed discussion and a more in-depth discussion about what PrEP is as well. We're doing community radio station adverts and discussions as well via podcast. And we're also using lots of social media advertising. Next, please. So just to round up, like I just wanted, I put this slide. I knew I was going to come sort of last in terms of the presentation. I put this slide, I just picked up some key thematic area sort of examples of what people are saying. And somehow I knew that Judy, Jeni, and Will were going to talk about it, but it's exactly the things that we're talking about. So there is quite a lot, like the top one on the one at the top to the left, which that one where Cham has got the cursor. That is a theme which is coming out. What about gay men? Is this really for gay men? And how is it working for gay men? So as you can see, this is like that guy there was meant for gay. The full conversation was meant like sort of around gay. So they're saying, well, this is, how is it going basically with the white gay community? Why should we be using it before the findings have come out from that community? So this person was quite keen on getting information that has been proven to work. Also, what was interesting is like there are issues to like, are you a prostitute, for example? Like there's quite a lot of that which comes up all the time when people talk about it online. And these are some of the issues that we have to contend with, that the stigma is still there when it comes in. But one finding, I think, which maybe hasn't been spoken about here as much, is the confusion between PEP and PrEP. We found quite a lot of people say, I know about PrEP, but when you ask what PrEP is, they are talking to you about PEP. So like this one is an example, the one which is the big dark one. I found it as an example of people saying, well, you've got it wrong. We had a number of these where people are coming to us and say, we've got the messaging wrong about PrEP, because PrEP, you have to take it within 72 hours. So we've got that challenge of ensuring that we actually get people to understand also the difference between PEP and PrEP, because there are some people who know about PEP, but we need to make sure that they have sort of the difference. There is the issue around access. As you can see, we did say it can be accessed for free. People are saying it's not free. So you can't say it's free. So this is a challenge for us, where we already have, I would say, the bigger percentage of people need information about PrEP, but those who actually know something about PrEP have got the perceptions that they will have to pay for it. Therefore, it's putting a barrier to them trying to access it. So that is something that also has to be addressed. There were some issues around, is this going to lead to STIs? So I just put like an example there at the bottom, where people have said, well, I think it's still safer to use condoms. Like, is this going to lead to STIs? And I just put that one because I thought it was succinct, like in terms of how it explains itself as a message. So all in all, what is happening, this campaign at the moment is live. We've had, at the moment, over the past 2 weeks, we've had, I think, close to 40,000 page visits. Quite a significant are also coming from the, they're coming from the influencers themselves. So what we did with the influencers is to create sort of unique links for them that they're also sharing via WhatsApp. They're sharing via like their social media channels, and sort of driving people to the website. What is interesting, however, as well for me, is that people are not having open conversations on social media. Like, they're not having the open conversation. They're all in the messages. So they go into private messages. So one of the things that we're having to do at the moment is when they ask complex questions, because we're having to work with the influencers to answer those questions for them. So you see people sort of, they'll click on it, but because it's an HIV thing, they don't actually sort of comment on it. You see sort of messaging sometimes as well from the same influencer. They'll say, well, they are actually surprised, the influencers themselves, that people are clicking so much on some of their links, but they wouldn't like, they won't put a like, they won't put anything which will associate them with that post, but they don't go to their direct message and ask the question via that route. And we're seeing this happening a lot via WhatsApp as well, which is quite an interesting thing. So I think, like Judy said, let's also just accept that people already have their ways of communicating with each other within the communities, and we're not going to recreate something which is new, which is going to work differently. It's about ensuring that we equip people, like we were saying, with the ability to have complex conversations. They are able to talk, some of the influencers, because we've given them sort of briefings on what to talk about. But when it gets complex, which is fine, we've said, okay, just send a message to us and then we can help you to answer much more complex. But it would be lovely if people could answer more complex conversations, lots more people out there, without having to have that referral system. So I'll end here for now, and then we leave it to Cham. And yeah.
Wow, great. What lovely presentations and insights, all saying very similar things. And I think leaving us in a really good position to say, okay, this is what we've learned. This is what people are telling us, what their experiences are. These are their attitudes towards PrEP, some of the confusions, the myths, what approaches they find acceptable, what would work for them. And now we think, like, how do we translate what we know and use that to really work with each other and, to work with others in the sector, whether that's our sexual health clinics or commissioners, Public Health England, to really now take a step forward. Because I think one of the challenges in my perspective, is that, you know, when you talk about equitable health access, whether that's access to information or access to services, it all has to be part of the big picture. And we know that there has to be a balanced approach, a targeted approach. You know, we have to balance effectiveness, equity, and affordability. And so I think my biggest question is really, how do we need to move from an ideal, which is, you know, universal PrEP access, ideally, because anyone who is HIV negative stands to benefit from PrEP, regardless of whether they're Black African or any other ethnicity, whether they're gay or bisexual, whether they're trans or non-binary, everyone stands to benefit from it. But what are the key areas that we really need to focus on, whether that's geographically, you know, even within communities? In some of the conversations and the outreach that, you know, even I've done personally, I know many people who say, you know, now that I've heard about PrEP, I think this is a great option for someone else. Now, maybe part of that is because they don't see themselves as being in a risk category, an at-risk category, but maybe some of that is their choice. They really don't think that in their position, this is not right for them. So how are we able to maximize our approaches to really, and our resources, which as you've pointed out is limited and often time-bound, to really maximize and really reach those individuals who stand to benefit the most from it? So it's an easy question, isn't it? Jeni?
It's huge. I think that's the problem. I might just tackle a little bit of it. I've kind of lost my way a little bit as well. I think it's just about making it more accessible. At the moment, it's not accessible. And the way we're it's not actively promoting at the moment. And I think we're worried about overloading the system, and we've got COVID in the middle of this as well, which is completely changed how we do outreach and how we engage with communities, which is a huge problem. And we've got a lot of fear and anxiety and poverty out there at the moment, which puts people more at risk. And it means that sexual health has probably gone further down that list of priorities than it was before COVID and before everything else was going on. And everything's going online. And for lots of people in the communities that we're talking about, that's not accessible. Along with sexual health services being limited due to COVID, but also not accessible to large chunks of the population. And until we can think of other ways to deliver PrEP, I think it will continue to be challenging to be accessed. Yeah, I'm not sure I answered any of your questions. Sorry.
Well, you did touch on it, and that was good. It actually also linked quite well to one of the questions in the Q&A, which is on how do you think COVID has affected this work, and how can we continue in a lockdown scenario? Jeni, would you mind sort of continuing just on that thread?
Well, so I think it's just summarising what I've said. I think COVID has stopped community outreach completely. And in essence, that's a really good way of engaging hard to reach communities, as we would say. You know, communities are not hard to reach, but you need to go out there and talk to them. We need to get out into communities, and at the moment we can't do that. Technically we are now talking about hard to reach because we can't get out. So that's going to be the biggest impact, I would think, in terms of COVID. And as I say, poverty. Poverty is going to already hitting communities badly. That's probably going to get worse. And with poverty, you know, more people turn to sex work, more people take more risks, you know, and things like that. People can't afford to buy PrEP online if they were buying it online, and all those kind of things. So I think they're pretty huge.
Well, having launched the follow-up campaign linked to Mob Presh, Sisters Are Doing It For Themselves, having done that in the midst of COVID and everything, how has that uptake been? How has lockdown affected it, or do you think will impact its reach and its impact?
Sure. Well, I mean, I think lockdown is impacting on absolutely everything that all of us will do. The kind of places where we might have put a physical booklet as restricted. We can't put them in clinics. We can't put them in venues. All of those things are having an impact on all of our collective ability to deliver. I really want, there are two things that I want to kind of build on that Jeni's just spoken about, and that's we really must continue to invest in face-to-face outreach. Face-to-face outreach is being completely held up by COVID, but we all collectively know that whilst it's expensive to do, and it's often complex to do, and it's sometimes dangerous to do, it is probably the most effective tool that we have in talking to people about PrEP and sexual health. And all of us have invested quite a lot of money and resourcing into fabulous booklets and social media ads and TV ads and broadcast media. These things are important, but they are only important when outreach is invested in alongside them. And we all know that collectively investment in face-to-face outreach is diminishing, either through national programs or through local or regional programs. More positively, I want to take us back 7 or 8 years to those of us who were doing this work at that time, and remember that the PROUD trial. The PROUD trial was the precursor to the IMPACT trial. The PROUD trial recruited 550 MSM in England, and I was involved on the periphery of the community advisory group for the PROUD trial, and we found it hard in the first year to get more than 300 men recruited into the PROUD trial, and we had to do a lot of work to get those numbers up, and it was only towards the end of the PROUD trial that we managed to recruit 550 MSM onto the PROUD trial. Let's reflect now that on the IMPACT trials that's come to a close, almost just shy of 26,000 people enrolled on the IMPACT trial. So 26,000 people currently in England have or are using PrEP through the trial. And whilst it's a small number, only 4%, but 4% of those people, so 1,000 people who are not gay or bisexual men, are accessing PrEP through the IMPACT trial. So almost double the number of people who are not gay men accessing PrEP now who were at the end of the PROUD trial. It took us a lot of hard work to recruit to PROUD and then to get the numbers up onto IMPACT. And that happened through, community advocates, through the hard graft of going and speaking at events, going and speaking to venue owners, going and speaking to the media. It has to be a multi-method approach, but we got a critical mass. And when we can get that critical mass, suddenly PrEP takes off. There was a kind of suddenly a tipping point. That's the tipping point that we need to start working towards with those communities of people who currently aren't able to access PrEP. And some of that has to be done through face-to-face work and going and talking and really doing that old-fashioned kind of footwork of stomping around different places and having often difficult and often challenging conversations. And as Taku has reminded us, sometimes those conversations need to happen again and again and again so that we're building up people's knowledge over time. And that work is expensive and it needs investment in.
Sorry, Cham, can I just jump in?
Yeah, go for it.
So I think like we were said, so I want to talk for men, just for a bit, because I think one of the things is every year we work with a big football tournament every year, and we engage hundreds of men there. And we work with a number of festivals around London as well. And what is interesting is, I think, for example, the challenge which is there around the loss of some of the face-to-face opportunities as a result of COVID is the dimensions in which some of the conversations happen. So at the moment, like I was talking about, people were sending lots of messages via DM, direct messages. Quite a lot of those are women were sending sort of messages. When I say maybe the quality of the questions which are sent in by guys, they're quite different as well to maybe some of the questions sometimes that we have in face-to-face environments. I know we talked about men. Let's not lose hope in engaging men, because one of the findings for me, which is a frustration, is that I think we are forgetting African men. Yet when we do outreach, most of the times they are the ones who are more likely to say, I want to get on it, how do I get it? But we're not having conversations with them adequately around PrEP at the moment, I feel. And so I think as we move forward and we're thinking about sort of the challenges of COVID, let's think about how the loss of face-to-face also impacts on some of these men who are now not asking some of the deeper questions that they've been asking within the face-to-face environments.
Yeah, thank you, Taku. Judy, just following on from that, I think some of the examples you gave as well around how people in the community may then say, this could be something useful for me. Touching on that point, touching on, some communities where, having, those polygamous relationships are sort of culturally the norm, or having, second or third regular partners, which are not casual. In what scenarios where that's a heterosexual relationship can actually raising awareness of PrEP and increasing accessibility for the men also protect the women in that scenario? So I guess what I'm trying to say is, like, do we need to be talking more in a targeted way about African men, for their own prevention, but also for women as well?
I think precisely that's the point, and I think what is really important for us to highlight is the PrEP message for an African man is very different from the PrEP message for an African woman. And if we can identify how to package that message, it will be received better. I know that COVID has stopped a lot of outreach and a lot of face-to-face work, but COVID has also given opportunity for informal groups to be formed during this session that are discussing a wide range of topics. For some, now people have the time to communicate, and some people are challenged with all the social, they're not on the Twitters and the Facebook, but they're on WhatsApp in groups. And they have so many groups that keep them up to date with what is happening. And this is where information is fed and is absorbed. It's an opportunity for us to maximize on these informal groups that are happening. Secondly, I just wanted to, around access, again, it was one part of the question. I think it's important, like Will has highlighted, one size is not going to be, let's have multiple ways of accessing PrEP. Let's not focus on one way. I know it is through local authority. I know it might be easier to manage that way, but we also have to identify that we've got to have other channels through which PrEP can be accessed. And then the last, in terms of answering what you're saying, I'll give you an example of my hairdresser. My hairdresser, well, apart from COVID, but she does the hair from her own house. She's got 2 children. She walks these children to school, comes back, listens to Ghanaian radio, watches Ghanaian TV, communicates on Ghanaian WhatsApp. She does not listen to mainstream media, does not listen to the news. There's nothing. So how do you reach that person to tell them about PrEP? And like Will said, it's not about opening your line about PrEP. It's about calling them for a meal. Let's get a meal together. Let's discuss hair. Let's discuss fashion. Let's discuss this movie. And then bring PrEP into that conversation. And then bring their whole sexual health into that conversation. For me, that's where we are missing the point.
Really great, Juddy. Thank you. I think you hit the nail on the head and really reiterated some of those key points we need to bear in mind. I'm just going to jump now to the Q&A. Quite a few of them were for you, Jeni, around how you engaged with the communities in the first place on that project. Did you have any problems? And were the community champions paid?
Okay, the community champions weren't paid, they were incentivized, and we invested in their time, which I think is a very different thing. I think communities need investment. We can't expect people to do something for nothing. That's unrealistic and it's unachievable. So yeah, we did invest in their time. The other question was around, did we have, I wasn't sure whether that was before the project and whether that was about PrEP, but obviously PrEP is part of our HIV prevention work generally, you know, given awareness, but I think I kind of alluded to it in the presentation. When you ask people to come to a workshop or a session around PrEP, you're getting people that are either have some knowledge or are engaged in your work, or, you know, you're not necessarily reaching people that don't have any knowledge. So it was challenging, I think. And I think the model that we used for Prepared just opened up doors that we weren't able to open, if that makes sense. So yes, we had engaged with communities, and yes, we had challenges. Yeah, I think.
Yeah, in short. Yeah. Okay, just a quick follow-up. It did for me, but I think there's another one that's really just come in. Could you elaborate on what you mean by investing in their time and give a couple of examples?
Okay, so they were incentivized. So they receive a payment, but it's not being paid. Yes, they're incentivized with money, but we see that as an investment of their time. So it's an expenses, paid expenses, really.
Sure. Okay, yeah. Can't get more crystal clear than that. Thank you. There's a question for Taku. Taku, could you sort of give some examples of some of the influencers that we've engaged?
Maybe let me just explain like sort of like what sort of influencer I'm talking about. So what we looked at was the question of if we wanted to talk to people within the Nigerian community, who do we need to, maybe who can actually enable us to talk to more people within the Nigerian community? Who is somebody who people would listen to? Who is actually somebody who can have sort of the engagement with the Nigerian community. So what we have like within the Nigerian community is a mixture, for example, of DJs. We've got some people who are just online personalities in their own right, like they're just online personalities. And then we also have some influencers who are sort of subject specific. So people like Oloni, like so we're working with Oloni, she talks about sexual health. So it is sort of it makes sense within that. But I'd say 98% of the influencers are what I'm mentioning are people who are from different communities. So with Juddy, for example, we're working with DJ Billy, and DJ Billy works with Ugandan communities, and he's got quite a good following. Sort of to tie it in with the question to Jeni around investment of people's time. So some of them are paid something for their time as well, and some are not. Like some people, we've just got a relationship with them. They say, well, look, I will do this because it's important to me. But some as well, like it's been a process of saying, well, look, we're educating them as well, like in terms of it's a thing that they haven't sort of come at from a point of say, I just care about this. Some of them have learned to care about it, because one of the things when it was initially proposed to them, they were like, what is this, basically? And then we spent time to talk about why it's important and what it is, and they've come to care. But we're not paying big, by the way, like in terms of like basically the way we approached it to say, okay, if you're going to do some work as well, like sometimes what are the day rates like for something, and then we pay for people's time based on things like that. Some of the people that we're engaging with have got followings of say 200,000 people, and they have got maybe sort of 80,000 very engaged people. Like in those cases, some of them, they are people who, if it was another, like I know one of them works with Coca-Cola, for example, as a brand. Coca-Cola pays him thousands, like to do stuff. But with us, like, because he knows what we're doing, sometimes we can just pay even say 150 pounds, like for something that we would never get, like from a, like if we're like a big brand, they would never do the same amount of work that they do. Some of them, they would receive minimal amount of money and say, okay, I'm just going to do this. But I found they actually then go an extra mile always. They do lots more. And what is interesting, just for everyone's sort of reference, is most of the models that you've ever seen on the national program for testing week and everything, they've come through basically through that route of one person did it and cared about it, and they talk to the next person and say, and they're all voluntarily coming to say, well, look, I care about this, and they talk about it like in their communities. But there are different people, like Will said at the beginning, these are people who are happy to put themselves out there on the subject. There are some people who want to do stuff and they do it via WhatsApp groups where they're not going to be out there at all. They're doing it via WhatsApp groups. So it's a mixture of these different influences.
Thanks, Taku. Yeah, so just a heads up, so we have about 5 minutes left. So I just will round up with 2 questions, one from the Q&A and one of my own. And then we will wrap up all together. So the one from the Q&A is by Patsy Richards, and her question is, how have sexual health services engaged and supported these community PrEP projects? Is there anything specific commissioners could do to improve this? Would like to go first?
I'll go first. Our project was delivered in partnership with the local sexual health clinic, with one of the consultants who was heavily involved in delivering some training for the champions, doing some Q&A fact sheets and those kind of things. So they were very involved. They were also doing some monitoring at their end in terms of people who presented for PrEP to see how they'd heard about that. So that worked quite well.
Judy?
We also worked with the London local sexual health and also with like Dr. Vanessa, and who were very instrumental in coming and speaking to the community through community channels directly to answer their questions. And because they were professionals in their own right as doctors, people responded well to them, and that really worked. I think just what I will slot in, which is not even part of the question, but we referred in one of the referrals we made for PrEP, we referred someone to PrEP to a sexual health clinic. They went, and whoever they met, they asked the questions and they were turned away. And I think for me, it's also highlighting that with the sexual health clinics, there is training and awareness that needs to be put in place to understand the sexual behaviors of certain groups. It's not a one size fits all. So how certain, assuming that a woman will only have one sexual partner because she's told you she's married is wrong. And ask those right questions, because if someone's gone all the way to say they need PrEP, there must be a reason why they need PrEP, and they may not be upfront. We find with this community, they're not upfront to tell you all of their history about themselves. But if they've identified they need PrEP, I think credit that information and act on it, or maybe find better ways of asking these questions so you get the information you need. I know PrEP for Women was trying to come up with some a questionnaire working in clinics to just make sure that they understand the behaviors of people presenting, and they're able to then formulate the right questions to ask.
Okay, great. Thank you so much, Judy. So we've touched on a lot of things, and I think the main takeaway is we can learn from what we've already done, from who we've already spoken to, from the approaches that we've taken. We know that people want things that are in their language, to really take ownership of that, to really take the message on board, and to see and understand how it can apply to them personally rather to someone else. And that we need to really make an impact, there has to be some sustainable investment, and we have to move from pilot projects to more long-term programs, that there is a really strong and universal need, especially among Black African communities and others who are, disproportionately affected by, HIV, or not really at higher risk, but, it's more prevalent, that there needs to be really this ongoing conversation. They have to know about PrEP. Although then going on to accessing that is really that funnel approach. So we want everyone to know, and then to be able to assess whether they may benefit, and then to be able to access it. And really to make sure that for those who need it, that they can get it at an affordable or free price, ideally, close to where they are, where they need it, in a format that they can reach, whether that's at a sexual health clinic, over the counter, at their GPs, or online, which is one of the questions, but we didn't have time to answer that, about whether online access of PrEP, similar to STI testing, would be equitable. I think it would be equitable to a majority of people. We've seen really good success with testing for HIV and STIs in this community, especially when it's supported by community services. But again, there will always be those people, like Judy said, who just are not familiar with accessing services online, healthcare services, or social media, that they may never reach that. And so really maintaining that outreach element is crucial, despite the challenges with lockdown. So I think how commissioners and different funders could support this work in the community is to really invest with an eye on a long-term approach, and really hand in hand with community providers and sexual health clinics who have held that expertise, who have that rich learning from the impact trial. What can we learn? What can we take away to serve this community? And, I think if we understand that, people need to know about it, and also they need to be able to access it, because this will help them be in control over their sexual health. That long term, it will reduce the impact of getting an HIV diagnosis and living a life with that, and having to take treatment. That it's well worthwhile investing in and prioritizing. So I do encourage you, please send us any email, any further questions you have by email. We'll forward them to all the speakers. Thank you again. Thank you so much, panelists. It's been so enjoyable. And thank you so much, attendees. It's been really lovely having this. Thank you. And if you have to leave, you can leave. Thank you. Okay, I think there's still some people online. I wasn't sure if there were any last remarks that you had.
Longer term funding, I think, like Will said,
yeah.
I think that is the thing. Like, like even with this campaign that we're running at the moment, like we've been forced by so many factors to run it in a short space of time, rather than have it run longer. So,
yeah, I just think the more ways people can access PrEP, the better, and it's just got to be, so accessible, because no community has the same issues or the same problems or needs the same things. So it's just got to be everywhere so people can access it. So it needs to be online, but it needs to be in a clinic, and it needs to be somewhere else as well, in a community.
I think what we've also found is communities also get tired of you coming with these short-term projects. They come and they say, so, you're coming, and then next year this is not going to be there. You're just using us to tick your boxes. And we really need to go away from that, because in the end, they don't want to engage with you. I know we've done a lot of work with faith leaders, for example, but if you're going to work with them for 1 year and then you're not there the next year, then they're like, if you come back, no, I'm not going to burden my congregation or my community with this if there's no sustainability in place.
Can't say anything to
I
that.
think you lose no, you lose the learning as well, don't you? Because you move on to something else and things change.
I think
It's a
that is one of the biggest things which actually happened with this campaign, like that we like sort of the conversations that we had, like with Juddy, with Nyambe, trying to say, okay, guys, how do we make sure that what you've done isn't lost? So like the one thing which has been really exciting is the ability, for example, like the work that we're doing with DJ Billy, for example, is really good because he's done the work with like on PrEP and prejudice before. It's very familiar with what we're talking about, and we've managed to continue. And it's been interesting as well for him because he's getting more questions which are coming at different angles than before, and it's enriching his way of responding to some of those things, which is
Yeah.
Cool.
Great. Okay. Thank you. I think it's a wrap. Thank you very much. There was one Q&A as a conclusion, really nice, summed up by Isabel Carrick, which was, she's a commissioner and was saying, as a commissioner, Judy's example of someone who was turned away from a clinic is really important. Routine PrEP is commissioned in line with BASH criteria, but it would be really useful perhaps to have some case examples of the different scenarios that might apply, which practitioners might not be aware of, and to enable them to ask the right questions. It's a really, really great suggestion. Yeah, and something, you know, maybe we can all in our respective fields, as we try and look at that sustainability question, where do we go from here? How do you work with our commissioners, our local sexual health clinics, you know, to then start looking at those avenues. Yeah, great. Okay, thank you again. Thank you all. And yes, I will see you all sooner or later, I'm sure.
Thanks,
have a nice afternoon.
It,
Bye.
It was lovely. Thank you very much for this opportunity.
Thank you all. Bye.
Bye-bye.